This is basic information for providers who serve Oregon Health Plan clients. Oregon Health Plan is administered by the Oregon Health Authority, and within that Oregon Health Authority agency is Medical Assistance Programs, who administers the Medicaid program in Oregon. Again, that is the Oregon Health Plan. The agenda today, we'll talk about some objectives we have for what we hope you learn from this presentation, an Oregon Health Plan overview, eligibility and billing information and the tools to perform those, common terms and acronyms, the OHP website, and some resources. So after today, hopefully you will understand how to partner with OHP. Again, that is the Oregon Health Plan, Oregon's Medicaid program. You'll also know what options are available to verify eligibility and bill services. And you'll know how to find information about OHP. So if you have any more questions after today, you'll know where to go, who to contact. I'll give you some resources about signing up for provider announcements so you can stay updated on what's going on, and also so you can call somebody if you need some help with anything. Or email. You may not want to call. Okay, Oregon Health Plan. Just a little bit of background information here. Again, this is Oregon's Medicaid program administered by the Oregon Health Authority Medical Assistance Programs, or MAP. We provide health care coverage to income-eligible Oregonians, and our goals are to increase access to care, improve quality of care, make sure folks are receiving preventive services, all of that while containing health care costs. A little bit of history. We started in 1994 with a federal waiver to expand Medicaid coverage to more people, and we did expand coverage to some non-traditional populations within Oregon. And what we do is we use a prioritized list of health services to limit what services are covered. So we can cover more people by limiting the services that are covered, but we limit those in order of priority. So we'll talk a little bit more about that list. So just a visual of how OHP is different than traditional Medicaid. We strive to provide health care to as many people as possible with limited resources. So we do need to limit the covered services, but we're able to provide coverage to more people because we do it that way. Traditionally, Medicaid limits eligibility but covers many services. So coverage is pretty wide, but it's for less people with traditional Medicaid. So we're a little bit different in Oregon. So the prioritized list of health services, again, this is how we limit services that are covered for the Oregon Health Plan. This provides accountable, effective health care funding. That's its goal. It was created originally by the Health Services Commission. You'll hear a lot of people call it the HSC list, so if you hear that term, that's why. It's now maintained by the Health Evidence Review Commission, or HERC. And what the groups do is they consider the needs of the population, and then they compare the benefits of services that are available in the areas in Oregon. And then those services are ranked according to effectiveness. So the highest priority health condition is listed at the top of the list, and then those services or procedure codes and diagnosis codes that align with that health service are listed under that specific line on the list. I'll give you a visual here that may help kind of pull it together, and I'll talk about it a little bit more. So if you'll just picture a really long list, numbered 1, 2, 3, 4, and let's say, well, number 1 is actually pregnancy on the prioritized list. That's the highest priority in the state of Oregon according to these commissions. And under line 1, what you have is a health condition, and then a series of related diagnosis and procedure codes to that condition. And all of those procedure and diagnosis codes that are listed are acceptable procedure and diagnosis codes by the Oregon Health Plan. Now currently, as you're picturing your list, We have 669 health conditions or lines on that list. And then each line, again, I already said this, contains the health condition and then related diagnosis and procedure codes that are billable to the Oregon Health Plan. The current funding line is 476. What that means is that all the conditions that are listed from line 1 all the way through 476 are currently funded by the Oregon Health Plan, and those listed from 477 down to 669 are not currently funded by Oregon Health Plan. Now you'll hear people also refer to pairing on the prioritized list. To have something pair means that you have a diagnosis code and a procedure code that are found under the same line number. So let's go back to line 1. We kind of pictured that one. It's pregnancy. And we have our series of related diagnosis codes and our series of related procedure codes. For something to pair, that means that your diagnosis code is found in that diagnosis set and your procedure code is found in that procedure set that are listed under that line, and that means they pair on line 1. So you are looking for codes that do pair on the prioritized list and are found above that funding line. So we refer to that as above the line and below the line. We'll talk a little bit more about this and eligibility and how they relate. We'll also talk about the OHP website where you can find this list and take a look at it and the different procedure codes and diagnosis codes that are found on the list. You can also find information about the list on the provider web portal. And we'll talk a little bit more about the provider web portal as well. So I want to make sure that you can access this, but this is just kind of an explanation of what the list is, why we use it. Okay, so let's go ahead and move on to eligibility and service delivery. So it is the provider responsibility to verify eligibility on each date of service. So you do want to go in on that day and verify eligibility. What you're looking for in the eligibility file is, first of all, OHP coverage. Does this person have coverage at all? If they do have coverage, what benefit plan, or some people call this benefit package, are they in? The benefit plan does determine the level of service that that client is eligible for, so keep that in mind. And then also you want to know if that person is enrolled in one of our managed care or coordinated care plans, or if they are fee-for-service. Fee-for-service is basically what it means is that that person is not enrolled in a separate plan, so all authorization and billing comes through us directly here at MAP. So we'll talk more about that as well. Again, those are the things that you're looking for on the eligibility file when you do open it up. Know that the client ID does not guarantee coverage. Really, the only information on a client ID is their ID number and the date that that card was given, or the date that card was printed. It's not an eligibility date, so please do know that. And then client eligibility and coverage may change. This is the main reason we're telling you to make sure you check it on the date of service, because what if something changes? What if there's an event in their life and maybe their coverage ends or their coverage changes into a higher or a lower plan depending on income eligibility, or it could change to anything. Perhaps they were enrolled in coordinated care, but they became fee-for-service. So those things change, and our systems are, for the most part, real time. So do make sure you're checking on the date of service. Here are benefit plans or benefit packages that are available through the Oregon Health Plan. So we have OHP Plus. We have a supplemental plan. Lots of different stuff there. You'll see the Med plan is qualified Medicare beneficiary. That's where we're helping them pay their Medicare premiums and out-of-pocket costs for Medicare. A lot of people will argue that Med is not really a benefit plan for OHP, and I can get that because it doesn't cover OHP services, whereas the rest of our benefit plans actually refer to the Oregon Health Plan rules in order to see what is and is not covered. The Med benefit plan, because all we're helping with is out-of-pocket costs for Medicare, we are following Medicare rules. So that's an important one to note. And then, of course, we have our CWM, which is Citizen Alien Waived Emergency Medical Only. And then we do have a prenatal expansion of that CALM program. So lots of different benefit plans. And you can find out which services are covered, listed by benefit plan. At that link there, we do have a form that explains that the clients actually have access to that form. It was designed for clients, but you can take a look at it. You can also look at our general rules. So I'll show you a little bit later how to find the policies online and look at our Oregon administrative rules. One of those rule books is the general rules, and there's benefit plan information listed in that rule book, so you can know which services are covered by which benefit plan. Also, you always want to refer to the prioritized list and the fee-for-service fee schedule to determine if a service is covered. Service delivery. So covered services for clients are delivered through either coordinated care, managed care, or fee-for-service. So primarily in Oregon, we are in the coordinated care model. CCO stands for Coordinated Care Organization. We do have some managed care plans throughout the state as well, depending on the availability of services. Some folks are not required to be enrolled in a CCO. They have some sort of an exemption, and they may have to be enrolled in a managed care plan for, say, dental services, depending on what services are available in their area. So I do want to point out both, but let you know that the CCO model is the primary, and most clients that you're going to see are enrolled in a CCO. So coordinated care, managed care, both of those just mean that the state contracts with a plan to handle authorization and billing for those clients. And then fee-for-service, this term is interchangeable with open card. A lot of providers in the community use the term open card for fee-for-service, same thing. And that just means that MAP is handling authorization and billing. So you would just work with us directly, and even through our provider web portal or our electronic data interchange. Again, highlights for what's coming later. But just know that you would work directly here with us at MAP for a fee-for-service client. All right, just some of the codes you might see for coordinated care. It's CCO followed by a letter. That letter determines which types of service are covered by that CCO. So you'll see the CCOA is physical health, mental health, and dental. B is physical health and mental health. E would be mental health only. G would be mental and dental health. And you might see these codes listed in some of our eligibility systems. So I do want to make sure you're aware of those. Managed care, some of the ones you might see, I think primarily just dental care organizations at this point. We do have some folks who are exempt from CCOs, and they may have to enroll in a dental care organization in their area, depending on the availability of dental services in their areas. So please do be aware of that as well. Mental health organizations, and then some fee-for-service OHP clients may also have a primary care manager. And I list all of these under managed care because if you are using our provider web portal, there is a panel on the eligibility file that is titled managed care. And you are going to see any CCO or managed care plans that that client is enrolled in, including if they have a primary care manager. That's where all of that shows up on the eligibility file on the provider web portal, is under the managed care section. All right, so tools to verify eligibility. Again, you're verifying eligibility on the date of service for the client because eligibility can change. We have a provider web portal that is real-time eligibility on a web-based system. Here's our website for that system. We also have a telephone-based system, the automated voice response, and there's the telephone number. This AVR does require a PIN every time you access it. What I didn't mention is the provider web portal for initial access for the organization or the clinic or doctor's office, wherever you're located, that there is a PIN required for initial access to the provider web portal. And once that initial access account is set up, then the person that maintains that initial access account can set up other folks within the organization. Unlike that, the automated voice response actually requires that PIN every time you call in. We also have electronic data interchange. This is real-time eligibility, where our systems are basically communicating with each other, and you're sending over a batch of clients that are coming in, and we're sending back a batch that says, okay, here's the eligible, here's the one that's eligible, that type of thing. And then steps to verify a service is covered. So you have someone come in and they'd like to receive services. You do have to verify the eligibility on the date of service. So that's step one. Make sure they have OHP. Make sure that you know who you're billing. If they're enrolled in a CCO or a managed care plan, you need to make sure you do know that, because any authorization or billing is through that plan. Next, you refer to the prioritized list to confirm funding and or pairing. So we did talk a little bit about that. Funding line and pairing, meaning that the diagnosis and the procedure code are found under the same line item, under the same health condition. You can find the prioritized list on the provider web portal. That's that first bullet there, PWP. You can also find it online. Have our website list that file. And then if you need help referring to the prioritized list, if there's something that's not clear or you're not sure if something was funded or not, you can contact our benefit RN hotline. They're standing by to help you out with that. And then your third step would be to refer to the appropriate MAP guidelines. So I did mention the general rules do outline what is covered per benefit plan. You do want to make sure you pay attention to that, but we also have Oregon administrative rule books per program. So if you are a durable medical equipment provider, then you want to look also at the durable medical equipment rule book as well, and make sure that you're covered, that you are following those guidelines. And we have a number of different rule books depending on your type. If at any time, you can find those online too. There's a link there. And if you need help with the guidelines, maybe something's not clear to you or you're reading it one way and you're not quite sure that you have it right, then we do have a provider services unit that you can contact as well. So they're standing by to help you with those types of things and any fee-for-service billing questions that you may have as well. All right, so that's how you verify that a service is covered. And let's talk a little bit about billing. So do pursue all other resources before you bill OHP. We are the payer of last resort. So if your client has any private insurance, they have Medicare, you do need to pursue those resources before you bill us. A lot of time you'll hear folks refer to private insurance as TPL. It is listed under a TPL panel on their eligibility file, the provider web portal, so please be aware of that. That just stands for third-party liability. And then also, providers are responsible to bill the appropriate party, and I mentioned this already a couple of other times. Fee-for-service or open card, you bill us directly here at MAP. Any coordinated or managed care plans, if you're providing services under them, you do authorize and bill those services through that CCO or MCO, and you do have to contract with them in order to do that. So it might be beneficial for you to find out which CCO is operating in your area and any other plans that may be operating in your area for OHP. Okay, and a little bit about billing an OHP client. Providers are prohibited from billing a client for anything that's covered by Medicaid. You can only bill a client if all of these criteria are met. So the service needs to be a non-covered service by Medicaid. All reasonable covered treatments are either tried or the client is aware of them and chooses a treatment that's not covered. And the client and the provider must have completed the OHP Client Agreement to Pay for Health Services, the MAP 3165. I have a link to this at the bottom of the page here. Also, if you were to go on our OHP website and select Forms and just search for 3165, you're going to find that client agreement to pay. I'd like to give you the form number as well. The tools to submit claims, we have the provider web portal back up there. This is claim by claim, one at a time. Web-based billing is available 24/7. All you need is an internet connection and access, of course, to the system. It is a secure system. It gives you immediate claim status when you submit your claims, and then you can see the website again is listed there. We also have electronic data interchange, or EDI. This is electronic-based billing. We talked about this a little bit with the eligibility. This is a batch claim format where you can send over a whole batch of claims. It's ideal for large volumes. So if you are a larger organization and you submit a lot of claims, this is probably the way to go here. And the phone number for this group, if you wanted to get in contact with them, is listed a little bit later in the slides. So stay tuned for that piece. But again, it's really ideal for larger providers that are submitting lots of claims or verifying eligibility for lots of claims. And then we do accept paper forms as well, CMS 1500, UB04, depending on your provider type. Professional providers use the 1500, institutional providers use UB04. There's also a dental claim, pharmacy claim. Now with the paper forms, there is a chance for delayed, well, there is delayed claim status and payment. It takes a little bit longer. What we do is we receive those paper forms and we scan them into our system so that they're accessible in our information system. And then whatever is scanned in is, there's an optical character recognition that reads that information and transfers it over to our Medicaid Management Information System, or MMIS, and then there's an increased risk of error because of that, because it's all automated in that way. The zeros may look like O's, ones may look like I's. If the information is listed a little bit to one side or the other, sometimes it doesn't pick up the first or last number or letter or character, I guess is the word I should use. So do keep that in mind if you are using paper forms, but we do, of course, accept them. I want to talk to you briefly about atypical eligibility. So there are a couple of options now, both options that came along with the Affordable Care Act, and they're pretty good options that are out there for folks to become eligible but to not be listed in MMIS right away. So I call it atypical eligibility. What if the client is not in MMIS? And again, MMIS is our Medicaid Management Information System. Any time that you are verifying eligibility or submitting a claim or an authorization for a fee-for-service client, all of that is done through the MMIS. So whether you're using the provider web portal or the automated voice response telephone system, or EDI, the information that you're getting back is coming from this MMIS system. So, we have someone who's eligible but is not in that system. So any way that you're verifying eligibility, it's going to tell you, hey, that person's eligible, but they might be. So let's talk a little bit about what that means. There are two options where a person may be OHP eligible, but their information may not immediately be available in the MMIS. And these are, first of all, hospital presumptive eligibility, that's HPE. And then there's the Care.gov online approval. I'll go over each of these in a little bit more detail. Let's talk first about HPE. Again, that's hospital presumptive eligibility. We have hospitals all over the state that are approving individuals for temporary, that's a very good word to hang on to there, temporary OHP Plus coverage. The first step is that they get an approval notice for this hospital presumptive eligibility for medical coverage. Again, I want to point out that is temporary. It actually says temporary in the title of that notice. This is issued by the hospital that determined this eligibility. It does confirm temporary fee-for-service coverage. The eligibility is immediately through the last day of the following month. So the example here and the example on the following page where I show an example of the letter itself the date of issue, if the date of issue is January 30th of 2015, then that HPE coverage ends on February 28th of 2015. This doesn't necessarily mean that OHP coverage will end, but according to the letter it ends, and if that person does not apply for OHP coverage in order for that coverage to continue after that end date, then their coverage will stop. So this is temporary in that the client still needs to submit a full application to the Oregon Health Plan for us to determine long-term eligibility. So do keep that in mind, that that coverage will end on that date if they're not found eligible after that date per their application and eligibility requirements. Also, MAP guarantees payment for covered services and prescriptions. Keyword there is covered. So covered services and prescriptions on a fee-for-service basis. We're guaranteeing payment for folks who have this temporary eligibility. The individual, again, I've already covered this, must apply for OHP coverage by the HPE end date for continued coverage. Otherwise, that coverage does stop. So let me show you that letter or notice. So you'll see right there in the title, right here, approval notice for hospital presumptive temporary eligibility for medical coverage. There's a little bit more information about OHP and the health ID, why this letter is here, and it actually tells this person that they need to apply for coverage if they want to go beyond this date. So you'll see client information listed here at the top. Right here we have the date of the notice. That's the date that they become eligible according to this notice. And then down here, we'll see the date that the coverage will end if they don't become eligible through a regular application process. So for this letter's purpose, this person is eligible from January 30th of 2015 through February 28th of 2015. Also included on the notice are hospital and the hospital representative information right down here. That. So OHA, that's the Oregon Health Authority, responsibilities for HPE, or hospital presumptive eligibility. We do accept the hospital's decision without question. The only reason we would not accept the hospital's decision without question is if the determination is from a non-qualified hospital. We do have to make sure that those determinations are coming from qualified hospitals in Oregon. If the individual already has current OHP coverage, then there's no need for the hospital presumptive eligibility notice. If the individual has HPE currently, so they're already eligible with an HPE temporary eligibility status, or they have had HPE within the past 12 months. So there is a little bit of a time frame there where they can only have the hospital presumptive once within every 12 months. We do expect that they would apply for OHP if they have this temporary eligibility. Another responsibility, we will not reverse or retroactively terminate HPE decisions under any circumstances. And then for HPE individuals, we will enter individuals in the MMIS, ensure that they receive services on a fee-for-service basis, and send an OHP ID card and coverage letter to eligible individuals. So they will receive that information in the mail. Even if they don't apply for OHP coverage after that, they'll still have an ID card. And again, I just want to mention there that the ID card is not guaranteed eligibility. And this is a good example of why. Because if their eligibility ends on February 28th of 2015 and they did not apply for OHP or they weren't found eligible after that date, they're still going to have that ID. And they can still bring that to you. And this is why we tell providers, please do check eligibility on the date of service. Verify that that person is eligible. These are just a couple of examples where you have a letter in front of you that says, hey, this person is eligible. And please do accept them before they end up, or before they appear in MMIS. Okay, the healthcare.gov process. So this is where someone has gone online to the healthcare.gov website, and they've self-reported information on that website to see if they're OHP eligibility, or to see if they're OHP eligible. So healthcare.gov, regardless of the decision, does automatically issue a letter with results of the decision. So the first thing that you might see is confirmation of Medicaid coverage for people found eligible, and that's effective immediately. I'll show you this letter in just a moment too. So if the letter states, yes, you're OHP eligible, then that coverage is effective immediately. This is another situation where you might see that letter. It says they're eligible for OHP. You can't find them in our systems because they haven't been entered yet, but they are eligible, and we are guaranteeing payment for covered services for those clients. So we do want to make you aware of these situations. Another letter that might be issued by healthcare.gov, so do make sure that you look at the results on these letters. Another one might say that more information is needed, and then a third one might say that they're not eligible for OHP. Some of those ones will also tell them that they may be eligible for a cost-sharing plan through another vendor, things like that. But do look at those results, and what you're looking for if you want to serve a client on OHP is that they are eligible. So I'll show you those pages in just a moment that have that result. And then secondly, again, MAP guarantees fee-for-service payment for covered services and prescriptions for patients that have this eligibility confirmation letter with the result of eligibility for OHP. And here's an example of a letter where someone is eligible. So you'll see it looks different than the HPE letter. And this is something that someone will print out and bring to you. So you'll see the client's information at the top, and then that application date, that is their eligibility date because it is effective immediately if they're found eligible. But do look at that table and look at those results, because if the results say anything other than this person has been found OHP eligible, and not exact wording, this is not exact wording of the letter, but the results are either you're eligible, we need more information, or you're ineligible, you may be eligible for cost sharing. So you're looking for OHP eligible. Keep that in mind. And then I'll show you another response in just a moment. The eligibility results on the healthcare.gov are according to the self-reported information compared to OHP eligibility requirements. And then here's an example of someone where the healthcare.gov website did not find them eligible right away, and OHP may need additional information, or does need additional information in order to determine whether or not that person is eligible at this time. So the letter looks the same, but you want to look at that results area and see what the answer is, what the results of their inquiry are. And then our responsibilities for the healthcare.gov eligibility confirmation. We will enter eligible individuals in MMIS. We'll ensure that they receive services on a fee-for-service basis prior to MMIS eligibility, and we'll send an OHP ID card and coverage letter to eligible individuals. So just a little bit about what you would do if you have folks coming in. They may not have an OHP ID, and you may not be able to see them in any of our systems. So it may look like they're not eligible, but they've got this letter. And it's either the HPE temporary eligibility, or it could be the healthcare.gov eligibility letter. So you've got a client that comes in with this, and they will not immediately be recorded in MMIS. So please do know that they may not be in there. We're working through them. We're putting them in there. We're getting them in there as quick as possible, but we don't want to hold back on allowing them to receive services. I mean, they're eligible, so please do keep that in mind as they come into your offices. Claims will deny if the client is not listed in MMIS yet. So if you have a client come in with the letter and you're like, oh yeah, I know the letter, and and you serve the client, you make sure everything is covered, you look at the prioritized list, the fee schedule, all of that. Remember, these clients are being served on a fee-for-service basis only. It is possible once they're enrolled in MMIS that they may be put in a CCO, but during this period where they're not in MMIS or they're not enrolled in a CCO, then they would be fee-for-service. Just know that those claims will deny if you submit them at the time when the person is not in the system. Once the person is in the system, we'll retroactively date it back to the start date of coverage, and you'll be able to enter those claims. Go ahead and submit them and get paid for those services. The provider steps to reimbursement, that's that third bullet down there. Number one, maintain a copy of that letter, whichever one it is, HPE or healthcare.gov. Do get a copy of that letter, put it in the client's file, make sure you have that on file in your office. Check eligibility to see if the client is in MMIS. It's possible they've had that letter for 2 weeks and we've got them in the system. They might be in there. So go ahead and check, verify eligibility, see if they're in the system or not, and make note of that. And then once a client is in the MMIS and showing eligible on the date of service, you can go ahead and bill the service just like you would any other service. Okay, but please know that if you bill the service when the client's not yet in the system, that the claim is going to deny. It doesn't mean you can't rebill it later. You can, but just so you know that. And then eligibility and billing tools. So we'll talk a little bit more about the tools we've already discussed, but just a little bit more information. So we talked about the provider web portal. This is a free web-based system. Initial access requires a PIN. Once access has been made under the provider ID, then other folks in the office can assign access. In the provider web portal, you can see eligibility. Eligibility file will tell you the person's benefit plan. It will tell you whether or not they're enrolled in managed care, coordinated care. You'll find that under the managed care panel. You'll see TPL, third-party liability. Again, that is private insurance. And then any service limitations and branch information will also be listed on the eligibility file. The prioritized list of health services is on the provider web portal, and you can look up a diagnosis code, a procedure code on a specific date of service and see whether or not that those codes are paired and whether or not they're funded. We also have prior authorization, plan of care, and claims available on the provider web portal. Do know that prior authorization and claims on the provider web portal will be for fee-for-service clients. If you're authorizing and billing services through a coordinated care organization or another of our managed care organizations, then that is done through those organizations, not through our system. So do know that. Then at the bottom of the page, you'll see there is the link again. And there's also a link to our website where there is some web portal instruction if you need a little help, either setting up your account, setting up other folks in your office to use the account, any eligibility instructions, list instructions. All of these instructions are on that page to do these different functions. The automated voice response, this is a free telephone-based system. Again, the PIN is required every time you call on this system. This will give you eligibility information. You'll know the client, you'll be able to hear the client's benefit plan, if they're enrolled in CCO or MCO, third-party liability information and service limitations. You can check for fee-for-service clients. You can check on prior authorization and claim status. You can also check on recent payment and suspended claim information. So that's the telephone-based system. And then, again, we have electronic data interchange. And as promised, here's the phone number at the bottom of the page. If you're interested in EDI at all and maybe getting that set up with your company and us, then you can contact them and talk to them about those processes. So it's an electronic-based information exchange. Again, it's ideal for large volumes. You can verify eligibility, you can submit claims, you can receive your remittance advice, which is basically your explanation of benefits document that we out. And you can also sign up for electronic funds transfer or direct deposit, same thing. Right, and I do want to go over some acronyms. We have gone over a whole bunch of them already today, we've already said. So let's just look at some of the ones that we have talked about today. There's only a few on this page that I didn't really go over. I talked about the CMS 1500 claim form, but I didn't tell you what CMS was. CMS is the Centers for Medicare and Medicaid Services. That's the federal agency that oversees Medicaid plans, different states. So these we talked about. I may not have said POC, but that's a plan of care. And QMB, that's that qualified Medicare beneficiary, that person whose Medicare out-of-pocket costs or something that we're helping with. UB is uniform bill. Our institutional providers, or all institutional providers, use a UB04 if they're doing paper claims. So these might just, people might just say these when you're talking to them here. So I do want to make sure that you have a little list of them there. And then department acronyms here. We have the Department of Human Services and the Oregon Health Authority, sister agencies really. We all used to be a part of the Department of Human Services, and then the Oregon Health Authority broke away as a separate agency that is focused on health. So you'll see the different divisions under each of these agencies. Under DHS, we have Administrative Services, Children, Adults, and Families. That's where you would see the child welfare system, foster care, those types of things, and even food stamps, or SNAP, call it now. Aging and people with disabilities. And then under OHA, the Oregon Health Authority, we have addictions and mental health. We also have the Administrative Services Division. Medical assistance programs, MAP, we're the ones that administer Oregon Health Plan. And then there's the Public Health Division. And I did want to throw in CCO, because that's a really important one, for Coordinated Care Organization. And again, most of our clients are enrolled in one of those plans. All right, and just some resources for you. I am going to go into the website and just go over a few things with you, but I want to make sure you have it all on one page. That's a link to our website. You could also Google Oregon Health Plan, and you're going to get to this website. And then we have our Provider Services Unit. If you do not know where to go, if you have a question, you're not sure who to call, this is who to call if you're a provider. So go ahead and give them a call, shoot an email. They should be able to, if they're not the group you should talk to, they should be able to point you in the right direction and get you connected with someone that will be of help to you. And then there's the provider training email as well if you need additional training or to know where some of our training resources are. Please go ahead and let us know. So I'm going to go ahead and click on this link to our website. We'll talk about the website a little bit. So I do want to point out, here's the Oregon Health Plan website, and on the left side, you'll see lots of links, some for clients, some for providers, some basic stuff about the Oregon Health Plan. This link will take you to the OHP policies. I talked about the Oregon administrative rules. You will find them there. Let's go ahead and click on that, actually, just so I can show you. They are listed by program. So you'll see the general rules. We talked about that quite a few times. Every provider is subject to the general rules, so do make sure you take a look at that rule book. It does explain benefit plans, what's covered or not covered under each, any limitations, that type of thing. And then you would also be subject to whatever other rules according to your provider type. All right. I'm going to go back to the main page. I'm going to get there by clicking on Oregon Health Plan right up here. And just a few more things I want to point out to you. If you look over to the right, under this orange panel here that says Healthcare Providers, you'll see there are OHP updates. If you want to see all announcements, you can look at that. We do have a newsletter that goes out monthly. It's called Provider Matters for some hot ticket items that are going on, so do take a look at that. You can sign up to receive any of these alerts and updates by e-subscribing. Let me see, where do we sign up for that? I believe if you click on this See All OHP Announcements or any of these, there will be an option to, oh, there it is, sign up for email updates about the Oregon Health Plan. Found it. And then I also want to point out that we have some services for providers here. We have provider training videos. We have self-service step-by-step guides on the provider web portal, about the provider web portal. You can find all of those there. And then also the AVR, that automated voice response. There's some instructions there. Direct deposit, EDI, electronic business practices. Become an OHP provider. We'll tell you about the provider enrollment process if you're not an OHP provider yet. You would also contact them if you had an address change or a change of ownership, anything like that. And then the last thing I want to show you is, well, before I get to the last thing I want to show you, you can access the prioritized list by clicking on this link here. You'll see the list. You'll see some extractive files that just are a numeric list of all the diagnosis codes that are found on the list, and then it'll be listed in numeric order, and it'll tell you the corresponding line numbers. Same thing for procedure codes, lots of good information there. There's more instruction in our videos and on our Tools for Providers page, which is where we're going next, on navigating that prioritized list. So please know that information is available to you. I'll go ahead and click on Tools for Providers and just show you a few more things. One of the main things I do want to show you on this page here is if you look right here, this second bullet here, we have a link to address and phone contacts. That is going to give you phone numbers, email addresses of anyone at OHP that you may need to reach for any reason. So that benefit RN hotline that I talked about, provider services unit, provider enrollment, what else did we talk about? EDI support. You will find all of that contact information, emails and phone numbers in that list. And then some important links up here I want to point out. We have billing tips where you can get instructions on billing, instructions on eligibility, fee-for-service fee schedule. I talked about that a little bit. That's an important thing to bookmark on your page. Keys to success. This is if you're fairly new to OHP, or maybe you're not new and you just kind of want some more basics. This Keys to Success document goes over a lot of the same information that we've talked about today. Here's another link to the policies, a link to the prioritized list, provider web portal resources. You'll find some step-by-step guides there and training videos for navigating the different functions of the provider web portal. Remittance advice. Instructions on how to read that are there. And then you can scroll down here and see questions and answers and different forms. You can get to the forms page. Remember I told you I like to give you the forms number just in case. That'll allow you to search for different forms. Lots of great information on Tools for Providers. That's what I wanted to show you. All right, I'm just going to go back to our page here just in case you needed to jot down a phone number or an email address or anything, and let you know that we are here for you. So if you need any assistance at all, please let us know, and we'll do our best to assist you or get you pointed in the right direction. Thank you so much for being here, and I hope this helps. Thanks.